As an advanced medical practitioner pharmacist practicing in family medicine, I know that high blood pressure, medically known as hypertension, affects millions of people worldwide. The problem is that a lot of people don't actually know they have it. Because you see, when it comes to high blood pressure, generally speaking, it's symptomless. So you don't get any symptoms, you don't get pain, you don't feel any different, but you've got this high blood pressure, which is increasing your risk of cardiovascular events. So in this video, we're going to discuss what is high blood pressure, why do your readings fluctuate, what causes high blood pressure, why it's dangerous, and how your blood pressure monitor actually measures your blood pressure. So at the end of this video, you're going to become a bit of a blood pressure pro, trust me. So first of all, what is blood pressure? To explain this, I want you to think of your heart as the pump that's constantly pumping your blood throughout your body through your blood vessels. And as the blood moves through your vessels, it basically creates pressure against the walls, and this is essentially your blood pressure. But here's the thing, blood pressure isn't a constant number, it changes with every heartbeat. So when your heart contracts, it basically pushes the blood out through the body, so that's when our blood pressure is the highest, we call that the systolic, and when your heart relaxes between beats, we call this the diastolic, and that's when your blood pressure is usually the lowest. So because of this, blood pressure readings consist of two numbers, and they're measured in millimeters of mercury. A normal systolic reading is anything between 90 to 120 millimeters of mercury, whilst a normal diastolic blood pressure reading is anything between 60 to 80 millimeters of mercury. But here's the thing, I'm going to make this bit very simple for everyone who's watching because this happens in practice all the time. Patients were told a long time ago that their blood pressure should be around this reading by a doctor 30, 20, 10 years ago or a medical practitioner, and they just go off of that. So I'm going to make this very simple. Unless you're told otherwise by your medical provider, you should aim to have your average blood pressure below 130 over 80 millimeters of mercury. Sorry, I'm losing my words. Anything higher than that, then you should speak to your medical provider and make them aware that your blood pressure is creeping above this. Here at A&D Medical, we are the inventors of the digital home blood pressure monitor back in 1977. So we definitely know how to get the most accurate readings. Now, it's important to remember, blood pressure readings naturally fluctuate through the day. So things like stress, things like our fluid intake, how hydrated we are, these can all have an effect on our blood pressure, which causes fluctuation. So let's say, for example, you're exercising or you're very stressed. This basically causes our heart to pump faster and our blood vessels basically tighten, okay? Think of when you're stressed and you feel tight and anxious, okay? It's kind of the exact same in your blood vessels, and this will cause your blood pressure to spike and go up. But by the way, please do remember that blood pressure fluctuations are quite normal when we're stressed and when we're exercising, so don't worry too much about that. Now, one thing I want to discuss as well, whilst we're on the topic of measuring your blood pressure, with our A&D medical blood pressure monitors, most of our monitors have advanced cuff fit detection as well as movement detection, all right? So basically it's going to come up with a symbol if it notices that the cuff isn't fitting correctly or there's a lot of movement, and this can be affecting your blood pressure readings and giving inaccurate readings. So it's just something to note about your blood pressure monitor, because accuracy is really important when we're looking at readings. So I guess the next question is, what causes high blood pressure? So healthy blood vessels do have a degree of flexibility, which is able to accommodate when our blood pressure rises or goes down. But here's the thing, there are certain factors that can cause our blood vessels to become more stiff and narrow, which basically will cause our blood pressure to go up. I'll share a few common risk factors for you. One of them is aging. As we get older, our blood vessels basically will become more stiff. The second thing is diet. If we're consuming unhealthy foods that are high in saturated fats, foods that are high in salt, it will cause an increase in blood pressure. The third thing is lifestyle habits. So if you're not doing any exercise, if you're smoking, if you're drinking lots of alcohol, these can all increase your blood pressure. The fourth thing is weight. Being overweight will increase your blood pressure. Basically, your heart has to pump a lot harder to push that blood and circulate it through your entire body. The fifth point is family history and ethnicity. Unfortunately, due to genetics, some people have a higher predisposition of getting high blood pressure. And the last factor is underlying conditions. Some medical conditions will cause an increase in blood pressure, as well as some medication, if you're being prescribed it, can increase your blood pressure as well. So why is high blood pressure dangerous, and why is high blood pressure called the silent killer? Well, first of all, like I said at the start of the video, blood pressure is symptomless, alright? Most people don't feel any different, so you don't realize you have high blood pressure until maybe 5, 10, 20 years for some people, because they're never checking their blood pressure that often. But here's the main risk factor. Over time, when you have high blood pressure, it can cause small tears in your blood vessels. Those small tears are where then the fat deposits and increases your risk of cardiovascular events. So these cardiovascular events, for example, can cause a stroke, where there's a blocked vessel to the brain, heart attack if blood flow to the vessel is obstructed, kidney disease because our kidneys, they weren't designed to withstand all that pressure. So if there's too much pressure going into the kidneys, it will cause damage to them over time. Generally speaking, that damage is irreversible as well. Moving on to blood pressure monitors. How do blood pressure monitors work? How do they calculate your blood pressure? Well, all of our A&D medical blood pressure monitors come with a cuff. This cuff inflates and deflates. So this cuff is then placed on your upper arm. It temporarily stops the blood flow, and then it slowly releases where the sensors detect the blood flow moving through the arteries through tiny vibrations. The monitors then use this data to calculate your systolic and your diastolic blood pressure, and then it presents it on our big clear screens for you to easily see the readings. So now that you've understood how the cuff works and how it inflates and deflates, one thing that is really important I want to discuss that not many people talk about is making sure that your device has cuff leak detection, because believe me, a lot of the blood pressure monitors out there don't have cuff leak detection, and it's not able to really tell if the cuff is inflating or deflating correctly. And if it doesn't have that detection, it's not going to give us accurate blood pressure readings. And this is exactly one of the reasons why I love A&D Medical so much and our devices so much. I don't know if I've mentioned it yet in this video, but at A&D Medical, we invented the blood pressure monitor, the digital home blood pressure monitor, in 1977. So we know a lot about blood pressure monitors. This device in my hand is our A&D Medical Precision Check Pro. It's one of our newer devices. It has a dual sensor fitted inside. So this basically means it's constantly checking for these, and it makes sure that you get the most accurate blood pressure readings. Now remember, since blood pressure fluctuates during the day, which we spoke about, medical providers like myself would usually ask patients to submit 7 days of home blood pressure readings, some done in the morning, some done in the evening, and then submit them. Now usually what we recommend is when you're taking your blood pressure reading, let's say you're taking your morning readings, you take 3 readings and you take them 1 minute apart, and then you average those readings. One of the great things again about A&D Medical and our blood pressure monitors, this device here is part of our Precision Check series, same device I've been speaking about before, where it has something called our TriCheck trademark technology. And what it can basically do is when you turn on the TriCheck technology setting, it will take those readings 1 minute apart, and then it will average those readings for you as well. This complies with the American Heart Association's recommendations for taking blood pressure. And best of all, this device and our other Bluetooth enabled devices are able to sync with our A&D Heart Tracker app. So it's able to get all of that information, store it on your phone, and then you can look at the trends, you can see how it's changing over time. So it's really, really useful. It's also useful to show your medical provider as well, so they can look at all your results easily. And if you don't have the A&D Heart Tracker app, it's free to download, it's free to use. I'd highly recommend everyone to consider downloading it and using it. You can get it from Google Play and the Apple App Store. Start using it now. And if you don't have a Bluetooth enabled device, you can just add the information in manually. Now, when it comes to controlling your blood pressure, the good news is there are many things that you can do at home and lifestyle changes you can make to naturally lower your blood pressure. We do have a full video on this topic as well on the channel, so definitely do check it out. I will give you a few lifestyle tips now, just some simple ones. First of all, diet. Make sure you're having a healthy, balanced diet. Avoid lots of ready meals, avoid eating takeout all the time, avoid eating a lot of processed foods that are all high in salt. Secondly, you need to stay active. Try and do 30 minutes of moderate intensity exercise every single day. Thirdly, try and maintain a healthy weight. If you're overweight, your heart's going to be pumping a lot harder to push that blood around the body, which increases your blood pressure. So try and consider losing some weight. Try the DASH diet, for example. We go through that in a lot more detail in our other videos. And fourth of all, avoid smoking and limit your alcohol intake to a healthier amount. If you're smoking a lot, it's going to make our blood vessels a lot harder. It's all going to increase our blood pressure. Now, here's a topic that many people aren't discussing, and it's temperature. How temperature affects our blood pressure. Believe it or not, when you're in a colder environment, our blood vessels constrict, which can increase our blood pressure readings. So if you've just been outside and it's really cold and then you come in, give it some time for your body temperature, especially your skin temperature and everything, just to come back to normal and the temperatures to come back in range. Now, what I personally love about the A&D Medical blood pressure monitors, for example, our new device, the A&D Medical Precision Check Pro, is that it records the ambient temperature of the room with every single reading. So what does this mean? It basically means you're going to see the temperature of the room for every reading, and it might actually help you notice an outlier in your blood pressure readings, because maybe your home was very cold that day, or maybe it was really, really warm that day, which again, all of it can affect our blood pressure reading. Now, whilst we're on the topic of blood pressure monitors, this is a real big one that, again, not a lot of people are talking about, and it's the validated device list. We call it VDL for short. I see so many patients coming into practice when they bring in their blood pressure monitors, they're buying them from, let's say, Amazon or wherever, and unfortunately those blood pressure monitors that they're buying, they're not on the VDL list, so they're not validated to give accurate blood pressure readings. So the take-home message is always make sure that your blood pressure monitor is on the validated device list. These lists are done by the American Medical Association, Hypertension Canada, and the British or Irish Society of Hypertension. Because believe me, a lot of the blood pressure monitors that you can buy on Amazon are not on the VDL list, so they're not accurate. And I've personally been using A&D Medical blood pressure monitors in practice for years, because one, they're an absolute workhorse, and two, they are on the VDL list. They have been validated for accuracy through formal studies. And to learn more about A&D Medical and our fantastic range of health devices, from blood pressure monitors to weighing scales to thermometers to pulse oximeters, I will leave a link in the description below. Definitely do check it out. We are committed to helping you stay healthy with reliable products. All of our blood pressure monitors come with a 5-year warranty if you're in the US, Canada or UK. Thank you so much for watching. I really hope that you found this information helpful. If you know someone who'd also find it helpful, please do share it with them. On our channel, we discuss a range of different cardiovascular topics, from how to use your blood pressure monitor properly to doing experiments and showing you how different ways of taking your blood pressure incorrectly versus correct can give you incorrect readings, and loads more. Once again, thank you so much for watching, and remember, A&D Medical, discover precision.